Well, thank you very much for that introduction. The good news is the surf is flat on the west coast today, so I can relax. Really fascinating. Thanks so much, Simon, about how we can use design thinking to address societal challenges. I'm really interested in that. But I guess at the core of today's talk, it's about connection. And in particular, how engaging with nature, outdoor healthy spaces, can foster greater connection and that sense of community. So I want to draw upon emerging insights and evidence from the Near Health Project. But first, I thought maybe we could just take a moment to actually connect. Without leaving our seats, we might go on a short journey. And I just wanted to invite you all to just take a moment to pause and notice our breath. And perhaps picture in your mind's eye your own favorite healthy space. That place where you feel happy and most alive. If you wish, it can help if you want to close your eyes. But just taking a moment to imagine that, and what do you notice about this place? Perhaps what sounds and smells do you notice? The touch, texture, temperature. And how does it feel to be there? Is it relaxing or refreshing? Calming or exciting? And for just one moment, breathe into that place, that feeling, and allow yourself to simply be. And gently, bringing your awareness back again to your breath, people on either side of you, and slowly journeying back to the room. Couldn't physically take you outside or to your happy place. But I'm just curious, if I could get a show of hands maybe, how many people saw, I guess, themselves outside to begin with? Okay, so I just asked, maybe it's been skewed by today's talks, but, but of those, how many people saw themselves in a green space? So it could be a park, a garden, woodland, yeah. And how many in what's called blue space? So near water, lake, sea. Oh, brilliant, it's quite balanced. And how many saw themselves perhaps with others in this space? And was that, was that, and so these are some of the things that we've been exploring, and I guess some of the things we've been inviting communities in Ireland to explore and share, you know, and is this sort of healthy space outdoors, is that nearby their home, or is it far away in wilderness? And that's kind of what we're looking at within our research and trying to understand that with communities in Ireland. But I'll just, before I dive into that, share a little bit more about how I came to be here and I guess my own healthy space. So it's been very much shaped by the sea. And I guess as a child, I go on these family road trips, down the coast and camp out next to the breaking surf, and myself and my sister would sleep kind of curled up between our parents. And I remember like staying awake late into the night to listen for a change in the sound of the sea that would signal either a shift in the tide or the arrival of a new swell. And I learned about the reef, the swell, the tides from time spent in rock pools as a kid, and watching as the tide ebbed, what I could discover, and watching it fill back in as my dad timed his surf for the flooding tide. And in that way, the sea has taught me that life is a continuum, this constant moving energy with no set, I guess, beginning or end, no hard destination or pressure to arrive at a certain point in time. I forgot I have the slides. And as a lifelong surfer, I was gifted, I guess, this blue heritage or sea connection through stories passed down, like this genetic code from my surfing family, ancestry, and place of belonging in Donegal. But it's not just me who has this blue heritage. The sea remains in the salt water of our blood, our cells, our DNA, from when those first animals came ashore and took up a land life. And in the words of environmentalist Rachel Carson, we are all linked with this watery origin in the ancient sea. We ourselves are bodies of water, and we're not separate from water bodies. such as the sea. But unfortunately, there persists this strong yet artificial divide between land and sea, between nature and culture, ourselves and our environment, that feeds this dualistic vision of the world and fuels a sense of separateness. So that divide between, I guess, ourselves and each other, and also the growing gap between our actions and who we really are. Part of my own journey has been about how we might begin to bridge some of those divides, and how do we overcome that disconnect between ourselves and nature, recognizing how entangled we really are with our environment. And my work is about creating spaces that facilitate nature connection for our health and well-being. And currently in my role as research fellow with the Near Health Project at NUIG Galway, we research outdoor environments, so blue and green space, and human health and how they're all linked, and also the restorative benefits of nature. And to do that, we're engaging with communities to understand how people in Ireland value and connect with nature for their health and well-being, and to better understand what the barriers and enablers are to engaging with the outdoors. Near Health is one of 3 projects, including EcoHealth and GBI Health, funded by the EPA and the HSE, and it builds on those 2 key policy drivers that have been mentioned today, the EPA Strategic Plan for our Environment, our Wellbeing, and Healthy Ireland. And when I say we, and I'm talking about connection and collaboration, and this happens within the research and design process itself and includes an interdisciplinary team of researchers and experts. So within this core team, I work alongside Katrina Carlin, project PI, and fellow postdoc Geisha Kinderman, who are here today. And we're advised and supported by colleagues from the School of Medicine and Social Marketing, Applied Ecology, the HSE, local and city councils. And I feel speaking here, I'm speaking on behalf of them, and the story that I share today has been shaped by all of us. I just happen to draw a short straw and have to be the one to get on stage. So I specialize, I guess, within that. You're all very aware at this stage of my bias towards water and the sea. But that said, I'm not the only one with this bias. And very quickly, I just wanted to highlight how much is beginning to emerge in this space, both in research and in practice around the world. Recognizing in particular that impact water, sea, coastal environments has on our health and the psychological effects of being on, in, or near water. Okay, so as we perhaps just experienced taking that moment, we know nature is good for us, and so why are we still seeking evidence? Well, it's complex and messy. We don't yet know how our relationship with nature impacts our health and well-being over time. We don't fully understand the mechanism, so how much nature, for how long, what type of environment or activity does what for who. And there are big gaps when it comes to understanding, I guess, rural and urban differences, gendered experiences, minority groups, and the cultural context. Nature therapy is a rapidly growing sector, yet very few nature-based interventions are piloted or designed in collaboration with researchers. And within this, it's typically framed as green space, and even less is known for blue space. So these, I guess, the barriers and enablers, what blocks us as well as what motivates us to engage with nature is still unclear and can be very influenced by the cultural context. For example, access and use of blue space in Ireland can be greatly influenced by how we perceive that environment. Fear of water being quite very common, and water as a place of loss as well as healing. And education and awareness being recognized as a key enabler or bridge. And that's what I want to spend the remainder of the talk kind of focusing on, bridges, especially the connective properties of engaging with these environments, in particular blue space. So this is not a salmon cage, but it's a grieving circle of surfers celebrating the life of a lost one. So again, when we talk about we and who we engage with and community engagement, that spans both urban and rural within the Near Health Project, and looking at very different and diverse user and interest groups in green and blue space. And this is across the restorative and preventative aspects of healthcare, those of us who are active as well as those who are not, providers, practitioners, and the policymakers and influencers. And we're also building autonomy and creativity into the research design process by asking people what their values and motivations are, what their barriers and enablers are to engaging with nature. So this is in over 90 individual in-depth interviews and a series of backcasting workshops where communities vision their ideal, healthy future space. What is clear is that we do value nature for our health and well-being. Yet how we perceive and understand and value nature, health and well-being and the link between them are incredibly diverse. Our needs vary in terms of access and what we want to do outdoors. In terms of bridges, however, social events, peer support and a sense of community are important for promoting nature connection. We're also evaluating a number of different nature-based solutions or interventions in partnership with local organizations and community groups. And this is to, I guess, measure what matters most without going in with the assumption of what that is. So we're assessing the impact of these different activities across blue and green space on our health and well-being, trying to identify what the measures are that matter most, the tools, the pathways that can be adopted by those seeking evidence-based impact through nature engagement. And for the purpose of this talk, I'm going to just draw on one of those as an example of how, I guess, a potential simple, accessible, everyday activity could positively impact mental health and create a powerful sense of community. So remember how I said it's complex and messy? And on the one hand, you have the tension between psychological benefits of coastal visits and how an influx of coastal visitors can contribute to marine litter. Beach cleans are one way to turn a perceived barrier into a bridge and can create a strong sense of community through shared values and actions. Kaylee Wild and colleagues ask, can beach cleans do more than clean up litter? So in their experimental study with 90 students in the UK, they found that beach cleans enhance well-being, and compared to other coastal activities like walking, rock pooling, there is a unique meaningfulness benefit associated with beach cleans. So we've been partnering and collaborating with Clean Coast, and they support over 600 coastal care community groups covering, so that's one group for every 5.5 kilometres of coastline in Ireland, and there's a lot of coastline. And that equals a huge contribution in volunteer hours with a massive value. So in collaboration with Clean Coast, Near Health have been piloting before and after survey design to assess what are the broader benefits beyond improvement of the local environment. And we're using a mixed set of validated measures across various health, well-being, and nature connection indicators. The findings, I just wanted to emphasize, they're really very preliminary at this stage from an initial pilot with 30 participants during September during the Big Beach Clean. They're not statistically significant, but we do hope to continue to develop this into a long-term study into the well-being impact of beach cleans with Clean Coast. And who are these people who participate? Well, there's a real mix of genders, mix of ages from as young as 9 to 61, and a lot of younger adults. And for most people, this was their first time to take part in an organised beach clean. You can see that the majority of people, they live near the beach or are regular beachgoers, but actually there's quite a few who are willing to travel quite a distance. And for some, I think 5 out of the 30, this was the first time visiting the sea or the coast in the last month. People reported generally high levels of self-reported health, which sometimes differs to what the indicators say. And the majority of the adults were employed full-time, so that raises the question of how might we better engage those from other economic backgrounds when we're talking about these kinds of activities and nature connection. And some reasons people get for taking part, like top among them were this desire to give back or contribute to the community, or simply even just getting out and meeting other people, as well as a love of that particular beach. So then how environmental preferences and attachment to place can influence our behaviours, as well as just getting outside, the education and engagement element for kids, and creating a cleaner environment. So we've used a number of different indicators and indices, and I'm just going to spotlight a few of them to illustrate the potential effects. And these are measured on a 7-point Likert scale. But perhaps I think what we might see here is how the calming and connective effect of coastal environments are suggested by a decrease in feelings of anxiety and disconnect. And can these kind of activities act as a natural mood enhancer? Well, people were already happy on arrival, even happier after. The greatest increase was in feeling refreshed and revitalized. So the activity acting as an energizer, perhaps because of a combination of doing something worthwhile, giving back, that social interaction, and being active outdoors in fresh air. We also looked at connectedness across 7 domains using a visual scale, and there's increases across all domains and reasons for that. But I just wanted to spotlight the greatest increase that emerged so far in sense of community. And I think this is perhaps one of the most impactful findings maybe for why beach cleans matter and the role that it plays in social connection and the importance of these coastal care community groups. And are there geographical differences? So it's too soon to say, and we need more evidence. But it is interesting to see possible differences suggested by the findings, for example, between the East Coast and West Coast or more urban and rural areas, with a lower sense of community connection recorded in the East Coast study in Dublin before the activity, and with greater gains perhaps in community connectedness immediately after the activity. And then how people are feeling themselves in their own words afterwards. So again, fresh, alive, energized, the calming effect. There's a lot of richness in what people are sharing. Just before I draw this to a close, another quick snapshot. So we're looking at the restorative benefits of nature connection, and one of those is working with a surf therapy program called Liquid Therapy, who work with young people on the autism spectrum. And along with the volunteers and coaches and the parents and the children, we've been co-creating and piloting an evaluation throughout the summer and autumn, and we'll continue into next year as part of, I guess, a more long-term or longitudinal study of which there's a real dearth. And just again, some of insights into their own experiences and their own words of what it is in particular about that environment, about water and the sea or waves, and the activity itself. But continuing the story of collaboration and community building, we co-organized a recent event, Mindscape Summit, and we were part of a group who launched a new national network linking nature, health and wellbeing researchers and practitioners in Ireland. So for those interested in learning more about that, please contact us. I think through the Near Health Project might be the best point of entry at the moment as we set that up. So I guess in conclusion, although there is much we don't yet understand in this emerging field and people-environment interactions are incredibly complex, you know, is it the coastal environment or the activity that influences well-being? What is clear is that how we are in relationship with each other and our environment really matters. And to draw on work by eco-psychologist Judith Holloway, when we overcome this assumption of separateness through shared and immersive experiences, we also experience this greater sense of relational connection. Thank you.